Virtual Masks and Artificial Hand Sanitizer, Digital Connection in a Time of COVID-19 by Austin Martin, Kira Droog, Alyssa Kulchisky, Theron Tolsma, and Mark Unruh. Narrated by George Mcfarlane. Chapter 7. COVID-19. T has been confined alone in our bedroom at the front of the apartment, where he complains of hearing trucks idling at the curb just outside and long blasts from the ships in New York Harbor a few blocks west. He creeps out only to go to the bathroom. The bedroom door stays firmly shut to keep out the cat, who is determined to get in and howls outside it at night. What to do if you are sick with coronavirus disease 2019? COVID-19, reads the sheet T is handed at the clinic 2 days after his symptoms begin. Separate yourself from other people and animals in your home. By then, he has a fever of 101.5. He tests negative for the flu. Then, because he is considered high risk with what his medical chart calls severe asthma that sent him to the emergency room with an acute attack a few months ago, he is tested for COVID-19. The disease caused by the coronavirus, just days before a national shortage of testing supplies emerged and the restrictions were tightened further. It seems nothing could have prepared the world for the global crisis that is and has been COVID-19. There has never been a pandemic on such a widespread scale affecting virtually the entire planet in one way or another. Its impact leaves traces in every sphere of life, whether it be biological, psychological, economic, or linguistic. Humanity was simply not prepared for this virus. As we have seen, large-scale crises have rocked the world many times over, with the most recent one, 9/11, still lingering in many minds. Adam Gopnik compares the novel coronavirus to terrorist strikes on September 11, 2001, describing how COVID-19 acts as a mirror image of the events of 9/11. The current crisis is, in some respects, the mirror image of the post-9/11 moment. That turned out to be a time of retrospective anxiety about a tragedy unforeseen. The anticipatory jitters weren't entirely unfounded. Anthrax killed a hospital worker in Manhattan, but they arose from something that had already happened and wouldn't be repeated. By contrast, the COVID-19 virus involves worries about something we've been warned is on its way. The social remedy is the opposite of the sort of coming together that made the days and weeks after 9/11 endurable for so many as they shared dinners and embraced friends. One of the main coping mechanisms for the millions who witnessed the horrific images was people's ability to come together in both public and private spaces and converse with each other, discussing their anxieties intimately and in person. This social connection is a necessity for nearly every person to function in a mentally, emotionally, and physically healthy way. One tragic element of the coronavirus, then, is this necessity being considerably restricted. With demands for physical distancing across the board, citizens have to find alternative methods to communicate with each other, promoting all forms of health. What is coronavirus? According to the World Health Organization, quote, coronaviruses are a large family of viruses which may cause illness in animals or humans. In humans, several coronaviruses are known to cause respiratory infections ranging from the common cold to more severe diseases such as Middle East Respiratory System MERS and severe acute respiratory system SARS. The most recently discovered coronavirus causes coronavirus disease, COVID-19, unquote. What then is COVID-19? Again, we can turn to WHO for this answer. Quote, COVID-19 is the infectious disease caused by the most recently discovered coronavirus. This new virus and disease were unknown before the outbreak began in Wuhan, China in December 2019, unquote. Numbers and symptoms. China, as WHO confirms, was the original epicenter for the virus, showing symptoms as early as December 8, 2019. From there, COVID-19 traversed the Chinese borders to some of the surrounding countries, with reports of the virus on January 20th, 2020 in South Korea, Japan, and Thailand in particular. The following day, the United States reported their first case. On January 24th, there were 2 confirmed cases in Europe, both in France. In the following weeks, China's numbers began to taper, while European countries like Italy and Spain quickly increased. At its highest point on the day of March 21st, Italy experienced an increase of over 6,500 cases. On March 27th, Italy saw its highest daily death toll, 919 deaths. Widespread concern about COVID-19 did not hit North America until mid to late March. In the United States, from March 21st to March 22nd, an increase in confirmed patients doubled and only increased from there. On April 21st, 2,693 people in the United States were reported dead on account of the virus, and April 24th saw the greatest daily increase in confirmed cases in the U.S., when more than 39,000 more cases were declared overnight. As of June 28th, across the globe, a total of over 10.1 million cases
Sample complete. Ready to continue?